When Marvella Ford was growing up, she did not see a lot of people who looked like her, and the people who did were suffering from disease and disability more often than people of other races. Decades later, the medical researcher and scientist explains how differences and disparities helped her formulate her life's work to become a healthcare leader and a patient advocate.
I think 2 days in a row that I didn't have to do anything.
Dr. Marvella Ford has been on a healthcare path for as long as she can remember.
I grew up in Plattsburgh, New York. It was a very, mostly a population made up of mainly white people. There were some Native American, American Indian people, and a few Asian American people. Most of my friends were white, obviously, because that's who lived there.
But her curiosity was piqued by who was missing in her life.
And they all had grandparents. Most of them had all 4 grandparents. And by the time I was born, all 4 of my grandparents had already passed away. When I looked at them and I looked at myself, I realized there's a racial difference. I remember as a child thinking, I'm going to find out and I'm going to help people so that when their kids grow up, they will have their grandparents for a longer period of time.
Dr. Ford said her parents were brilliant, but not academic scholars. But they made sure she and her brothers would be.
And I remember my father telling my older brother and myself, your job is to go to school and get good grades.
And she did, earning a scholarship and high marks at a world-class school, Cornell University, and then a doctorate at the University of Michigan, Ann Arbor. Years of training and research eventually brought her here to the Hollings Cancer Center and the Medical University of South Carolina, where she not only teaches medical students, but educates the public and puts access to care in neighborhoods, especially in rural communities.
We are very pleased that we have a brand new mobile health unit. I don't know if people know that the mobile health unit now that Hollings Cancer Center uses for mammography is brand new.
And that is not the only mobile unit Dr. Ford got rolling. She says the HPV van will save lives because it offers the cancer vaccine.
The van travels throughout the state. We work with school districts across the state to deliver the HPV vaccine.
Dr. Ford created a program that targets African American men. SCA Men helps men understand prostate cancer, treatment options, resources for support, and follow-up care.
In South Carolina, the prostate cancer death rate is 2.5 times higher for black men than for white men. That means that there's something that we can do. We can make a difference.
And she's making a difference in the lives of high school students, too. SC Cure, or SC Continuing Umbrella of Research Experience, has a record for directing minority high school students towards STEM education. From classrooms to clinical trials, Dr. Ford is at the forefront of encouraging black and brown people to be involved.
If people of color and other people across the community, rural residents, if we are not involved in these trials, then at the end of the day, it won't be clear how well those treatments will work for us.
She goes on to explain that because her mother died of complications of diabetes and her father heart disease, she was vigilant about her own health screenings. But in 2008, the doctor became the patient. She received a diagnosis she did not expect: breast cancer.
The cancer was detected at stage 0, which was really a blessing. I received great care. I feel very blessed to work in an institution where there are so many specialists. After growing up in a very small town where it was difficult to access specialists, it comes back full circle. So it's kind of maybe something that I didn't have in my life, the grandparents. Now other people will be able to enjoy their grandparents, their children, their spouses for a longer period of time. And it makes everything worthwhile. It makes all the late nights, the early mornings, the weekend work, it makes it all worthwhile.